Hi, my name is Jasmine Diaz, and for my post-surgical rehabilitation project, I will be focusing on Dupuytren's Contracture. I will be talking about what is Dupuytren's Contracture, what part of the hand is affected, causes, or more so who is at risk, non-surgical treatment as well as surgical treatment, and the post-surgical rehabilitation process. What is Dupuytren's Contracture? Dupuytren's is a hand deformity that usually develops over the years, and it's the thickening and tightening, which is a contracture part of the fascia, which is a fibrous layer of tissue that lies underneath the skin in the palm and fingers. A small nodule or lump develops in the tissue below the skin on the palm side of the hand. Over time, it thickens into a cord-like band. Usually there is no pain, but in rare cases, the tendons or joints become inflamed and painful. Other possible symptoms are itching, pressure, burning, or tension. Dupuytren's contracture can make it difficult to perform certain functions using your hand. Since the thumb and index fingers aren't usually affected, many people don't have much inconvenience or disability with fine motor activities such as writing. But as Dupuytren's contracture progresses, it can limit your ability to fully open your hand, grasp large objects, or to get your hand into narrow places. The two fingers farthest from the thumb are most commonly affected, though the middle finger also can be involved. Only rarely are the thumb and index finger affected. Dupuytren's can occur in both hands, though one hand is usually affected more severely. Causes and who's at risk. There is no direct cause of Dupuytren's, but there are many risk factors as well as people who are at a higher risk. Injuries and overuse of the hand don't cause Dupuytren's. The older you are, the higher the risk, most commonly after the age of 50. Men are more likely to have it, as well as having more severe contractures than women. People of Northern European descent. It can also run in families, and people who use tobacco and alcohol are at higher risk. Smoking is associated with an increased risk, perhaps because of microscopic changes within blood vessels, which is hypothesized, and also people with diabetes. Non-surgical treatment. Heat, soft tissue massage, and vigorous stretching can help loosen the tightening in early on stages. Corticosteroid medicine relieves inflammation and pain. It also works by not allowing thickening of the tissue to get worse. In some cases, it heals the tissue completely. Several treatments are usually needed. Collagenase is a substance known as an enzyme. It is injected into the thickened tissue to break it down. This treatment has been shown to be just as effective as surgery. And lastly is radiation therapy. Surgery is usually recommended in severe cases when the finger can no longer be extended, and it's also recommended when the joint at the knuckle of the finger reaches 30 degrees of flexion. Aponeurotomy, or otherwise referred to percutaneous fasciotomy, is recommended when the disease is still in its early stages, and it's also less invasive. A sharp needle cuts a path through the cord, weakening it enough to stretch it, extend it, or rupture it. Some disadvantages of this surgery are that it has a high reoccurrence rate and the potential for nerve injury, infection, and hematoma formation. Tissue release. This surgery releases the fibrous attachments between the palmar fascia and the tissues around it, thereby releasing the contracture. Palmar fascia removal, or partial palmar fasciotomy, is a surgery to cut out the fascia that lies deep under the skin, or remove part of the fascia or the whole tissue. The recovery process for each surgery discussed is about the same, with some procedures being longer, such as a complete palmar fascia removal. A few days after surgery, the dressing will be reduced. After that, it will take 11 to 14 days for the stitches to be removed. Swelling is common after surgery, so the patient will have to take pain medication a week after surgery. In the first couple of weeks of recovery, it should be focused on healing and then active plus passive range of motion. Do not use your hand until after the incision has healed, usually about 2 weeks after surgery. This includes lifting things that are heavy or doing repeated finger or hand movements. After the incision has healed and swelling has been minimized with elevation and ice, patients should focus on function and strength as well as massages and heat to prevent stiffness. Patients are recommended to increase the strength in their hands with tools such as a hand exerciser, foam, and putty. Time going back to work should depend on the profession, since you need to take into account that some jobs rely heavily on their hands. Lastly, here are some easy hand exercises I found for improving early on mobility. Thank you for watching my presentation on post-surgical rehabilitation with a focus on Dupuytren's contracture. If you have any questions, feel free to email me.